Friends, thank you for being here today. What if I told you that while the world looks to American hospitals and German pharmaceuticals for healthcare leadership, they're completely missing the country that has quietly assembled the most comprehensive health infrastructure on the planet? And what happens when everyone realizes that the future of global health security, medical innovation, and pandemic preparedness isn't controlled by traditional medical powers, but by one nation that most people think just has universal healthcare and says, sorry a lot? Most people don't know that Caada has become the invisible health superpower of the modern world. We produce 40% of the world's medical isotopes that save millions of lives annually. Our cold supply chain infrastructure is perfectly designed for temperature-sensitive medications and vaccines. We've pioneered the mRNA vaccine technologies that protected the world during COVID-19. But here's what should reshape how we think about health security. We don't just treat diseases. We control the medical technologies and supply chains that make modern medicine possible. This isn't just about having good doctors or free healthcare. We're talking about controlling the production of life-saving medical isotopes, the cold chain logistics that deliver vaccines globally, and the research platforms that develop breakthrough treatments. But here's the question that will define global health geopolitics. What happens when the world's health depends on Canadian medical infrastructure and we decide who gets access? This is the story of how geography, technology, and medical expertise are making Canada the undisputed guardian of global health security, and why the next medical breakthrough might depend more on Canadian supply chains than American research budgets or European pharmaceutical giants. Before we examine Canada's health dominance, we need to understand how dramatically global healthcare has become dependent on complex international supply chains and why controlling medical infrastructure has become the ultimate form of humanitarian leverage. The numbers reveal the staggering complexity and value of the global health economy. The worldwide healthcare market is worth over $8.3 trillion annually and growing at 7 to 8% per year. Pharmaceutical sales exceed $1.4 trillion globally, with specialty medications and biologics representing the fastest growing segments. The COVID-19 pandemic demonstrated how quickly global health systems can collapse when supply chains fail. Shortages of personal protective equipment, ventilators, and testing supplies affected healthcare systems worldwide. Countries with domestic medical manufacturing capabilities maintained better healthcare outcomes than those dependent on international supply chains. Medical isotope production represents one of the most critical and fragile components of modern healthcare. These radioactive materials are essential for over 40 million medical procedures annually worldwide, including cancer treatments, cardiac diagnostics, and organ imaging. Medical isotopes have extremely short half-lives, requiring continuous production and rapid delivery systems. Cold chain logistics for vaccines and biologics represent another critical infrastructure component. Many modern vaccines and treatments require continuous refrigeration from production through administration. Any break in the cold chain can render medications ineffective, creating health risks and economic losses worth billions of dollars. Pharmaceutical manufacturing has become increasingly concentrated in a few countries, creating supply chain vulnerabilities that affect global health security. Over 80% of active pharmaceutical ingredients are manufactured in China and India, creating dependency relationships that can be disrupted by political tensions, natural disasters, or pandemic-related shutdowns. The aging global population is driving unprecedented demand for healthcare services and medical technologies. By 2050, over 1.6 billion people worldwide will be over age 65, requiring medical systems and supply chains that can handle chronic diseases, complex treatments, and age-related healthcare needs. Mental health has emerged as a global crisis affecting over 990 million people worldwide. Traditional medical systems are poorly equipped to address mental health needs, creating demand for innovative approaches and treatment models that can be scaled globally. Antimicrobial resistance threatens to make common infections untreatable, potentially causing 10 million deaths annually by 2050. Developing new antibiotics and alternative treatments requires specialized research capabilities and manufacturing infrastructure that few countries possess. The most significant development is the integration of artificial intelligence and personalized medicine, which requires vast computational resources, genetic databases, and advanced manufacturing capabilities to deliver customized treatments to individual patients. This healthcare complexity revolution is creating new forms of medical dependency and strategic leverage. Countries that control critical health infrastructure gain enormous influence over global health outcomes and humanitarian policies. Now, let's examine what Canada actually possesses in terms of medical infrastructure and healthcare capabilities. Our advantages go far beyond universal healthcare. We control essential medical technologies and supply chains that the world's health systems depend on. Let's start with medical isotope production, where Canada controls a dominant share of the global supply for life-saving medical procedures. The Chalk River reactor in Ontario has been a primary source of medical isotopes for decades, producing molybdenum-99 that decays into technetium-99m, the most widely used medical isotope worldwide. Technetium-99m is used in over 30 million medical procedures annually, including heart scans, bone scans, and organ imaging. This isotope has a half-life of only 6 hours, requiring continuous production and immediate delivery to hospitals worldwide. Canada's position as a major supplier gives us significant influence over global medical imaging capabilities. When the Chalk River reactor was shut down for maintenance in 2007, it created a global shortage of medical isotopes that forced hospitals to cancel cancer treatments and delay diagnostic procedures. This incident demonstrated Canada's critical role in global healthcare systems and the dependency of international medical systems on Canadian production. The Bruce Power facility in Ontario has emerged as another major source of medical isotopes, utilizing existing nuclear reactors to produce lutetium-177 for targeted cancer therapies. This isotope is revolutionizing treatment for neuroendocrine tumors and other cancers that were previously difficult to treat. Canadian nuclear laboratories are developing next-generation isotope production methods that don't rely on aging research reactors. Cyclotron production facilities and linear accelerator systems are being deployed to ensure continuous isotope supply while reducing dependence on reactor-based production. Our cold chain logistics infrastructure represents another critical advantage in global healthcare supply chains. Canada's naturally cold climate provides significant cost advantages for storing and transporting temperature-sensitive medications, vaccines, and biological materials. The COVID-19 vaccine rollout demonstrated Canada's superior cold chain capabilities. Pfizer-BioNTech vaccines required storage at 70 milliliters, which created logistical challenges worldwide. Canadian facilities could maintain these ultra-cold temperatures with minimal energy consumption due to our climate advantages. mRNA vaccine technology, which proved essential during the COVID-19 pandemic, was significantly developed through Canadian research institutions. The University of British Columbia's contributions to lipid nanoparticle delivery systems were crucial for making mRNA vaccines stable and effective. Moderna's Canadian manufacturing facility in Montreal represents recognition of Canada's advantages in biologic production. The facility was established partly to take advantage of cold climate benefits, regulatory expertise, and skilled workforce availability. Canadian pharmaceutical companies have developed specialized expertise in cold-sensitive drug manufacturing and distribution. Companies like Apotex and Valent have built global supply chains that leverage Canada's natural advantages in temperature-controlled logistics. Our research and development capabilities in healthcare represent another dimension of Canadian medical leadership. Canadian universities and research institutions consistently rank among the world's best in medical research, contributing breakthrough discoveries that influence global healthcare. To understand how this translates into strategic leverage, we need to look at how global health systems depend on Canadian medical infrastructure, and how this dependence creates diplomatic and humanitarian influence opportunities. The global medical isotope supply chain demonstrates the clearest example of how Canadian capabilities create international dependencies. Hospitals in the United States, Europe, and Asia depend on regular shipments of Canadian-produced isotopes for essential medical procedures. During isotope shortages, Canadian suppliers must allocate limited supplies among competing international customers. This allocation process gives Canada significant influence over which countries and healthcare systems receive priority access to life-saving medical materials. International cancer treatment protocols depend heavily on Canadian isotope supplies. Lutetium-177 therapy for advanced neuroendocrine tumors is only available through Canadian production facilities, making Canada the gatekeeper for this potentially life-saving treatment worldwide. The pharmaceutical cold chain demonstrates another form of healthcare dependency. Countries with hot climates or unreliable electricity supplies often cannot maintain the cold storage requirements for modern biologics and vaccines. These countries depend on Canadian logistics companies for reliable cold chain services. Vaccine distribution for global health initiatives, including WHO and UNICEF programs, frequently utilizes Canadian cold chain infrastructure. Our ability to maintain vaccine potency during international distribution makes Canada an essential partner for global immunization programs. International pharmaceutical companies are increasingly locating manufacturing and distribution facilities in Canada to take advantage of our cold chain infrastructure. These investments create supply chain dependencies that give Canada influence over pharmaceutical access and pricing globally. Canadian medical research institutions serve as development partners for international pharmaceutical companies, providing research services, clinical trial capabilities, and regulatory expertise. These partnerships position Canadian institutions as essential collaborators for global drug development. The mental health crisis has created opportunities for Canadian healthcare models to influence international health policies. Canada's integrated approach to mental health, combining public health, community services, and clinical treatment, is being studied and adopted by countries worldwide. Canadian telemedicine and remote healthcare capabilities, developed for our vast geography, provide solutions for international healthcare access challenges. Our expertise in delivering healthcare services across large distances translates directly to serving underserved populations globally. I want to pause here because this raises an important ethical question that I'd love to hear your thoughts on. As global health systems become more dependent on Canadian medical infrastructure, should we prioritize maximizing healthcare benefits for Canadians first, or should we focus on providing equitable global access to our medical capabilities? This choice could define Canada's role in global health governance and affect everything from pharmaceutical pricing to humanitarian response capabilities. What's your perspective on balancing Canadian health interests with global responsibilities? Share your thoughts in the comments below. Beyond current medical capabilities, Canada is positioning itself to dominate emerging healthcare technologies and treatment modalities that could reshape global health systems for decades to come. Personalized medicine and genetic therapies represent one of the most promising frontiers for Canadian healthcare leadership. Our universal healthcare system provides access to comprehensive patient data that is essential for developing personalized treatments based on individual genetic profiles. The Canadian Biosample Repository Network provides researchers with access to biological samples and associated health data from diverse populations, enabling research into genetic factors affecting disease susceptibility and treatment effectiveness. Artificial intelligence applications in healthcare are advancing rapidly, requiring vast computational resources and healthcare datasets. Canada's advanced computing infrastructure, including supercomputing facilities and cloud services, provides platforms for AI-driven medical research and treatment development. Canadian AI research institutions, including the Vector Institute and Mila, are developing machine learning applications for drug discovery, diagnostic imaging, and treatment optimization. These technologies could revolutionize how medical care is delivered globally. Regenerative medicine and stem cell research represent another frontier, where Canadian research institutions are making significant contributions. Canadian regulations provide clear frameworks for stem cell research, while maintaining ethical standards that build international confidence. The Canadian Stem Cell Foundation coordinates research efforts that could lead to treatments for previously incurable conditions, including spinal cord injuries, Parkinson's disease, and heart disease. These breakthrough treatments could position Canada as a global leader in regenerative medicine. Medical cannabis research and development represent an area where Canada's early legalization provides significant research advantages. Our legal framework allows comprehensive research into medical applications of cannabis compounds for pain management, epilepsy, and other conditions. International pharmaceutical companies are partnering with Canadian institutions to conduct cannabis research that would be difficult or impossible in countries where cannabis remains illegal. This research leadership positions Canada to influence global medical cannabis policies and treatment protocols. Pandemic preparedness and infectious disease research have become critical capabilities following COVID-19. The National Microbiology Laboratory in Winnipeg is one of the world's most advanced biosafety facilities, capable of researching the most dangerous pathogens safely. Canadian infectious disease expertise was crucial during the COVID-19 pandemic and positions us to lead international response efforts for future pandemic threats. Our research capabilities and manufacturing infrastructure provide essential components of global pandemic preparedness. However, maintaining and expanding Canada's health leadership requires strategic investments in research infrastructure, workforce development, and international partnerships that many Canadians don't fully appreciate. Medical research infrastructure requires sustained long-term investment that can survive political changes and economic pressures. Biomedical research projects often require decades from initial discovery to clinical application, demanding patient capital and consistent funding. The Canadian Institutes of Health Research needs continued funding to maintain our research leadership and attract top international talent to Canadian institutions. Medical research is increasingly competitive globally, requiring significant investment to remain at the forefront. Skilled healthcare workforce development is critical for maintaining Canadian medical capabilities. Healthcare workers, researchers, and support staff all require specialized training that takes years to complete. Canada needs immigration and education policies that can supply the skilled professionals needed for expanding healthcare industries. International partnerships in healthcare research and development are essential for accessing global markets and sharing development costs. Canadian healthcare companies need diplomatic and trade support to commercialize innovations and compete with larger international competitors. Regulatory frameworks for emerging medical technologies need continued development to balance innovation with safety. Canadian health regulators must adapt to evaluate new technologies like gene therapies, AI-powered diagnostics, and personalized medicine while maintaining public confidence in healthcare safety. Manufacturing capabilities for pharmaceuticals and medical devices need expansion to support domestic health security and international competitiveness. The COVID-19 pandemic demonstrated the importance of domestic manufacturing capabilities for maintaining healthcare system resilience. If you're finding this analysis of Canada's health transformation valuable, please take a moment to like this video and subscribe to the channel. It helps us continue producing in-depth analysis of the healthcare and technology trends that are reshaping global health systems. The global health revolution represents one of the most significant transformations in human history. Countries that achieve leadership in medical technologies and healthcare delivery will influence global health outcomes, humanitarian responses, and quality of life for billions of people. Canada possesses healthcare capabilities that are almost impossible for other countries to replicate quickly. Our medical isotope production provides life-saving treatments globally. Our cold chain infrastructure ensures vaccine and medication effectiveness. Our research institutions develop breakthrough treatments that serve international markets. But possessing these health advantages is not the same as leveraging them strategically. Canada needs to make conscious decisions about how to use our medical capabilities while maintaining the humanitarian values and international cooperation that make global health systems possible. The next decade will be critical for establishing our role in global health governance. The investments in medical research, healthcare infrastructure, and international partnerships we make now will determine whether Canada becomes a major power in global health or simply provides medical services for other countries' healthcare strategies. The choices we make will affect not just our own health outcomes, but our ability to contribute to solving global health challenges that require innovative technologies and coordinated international responses. Friends, we are living through the transformation of healthcare from a local service to a global strategic asset. While the world's attention focuses on hospital systems and insurance models, the real power lies in the medical technologies and supply chains that make modern healthcare possible. Canada has quietly become the invisible foundation of global health security. Our isotopes enable cancer treatments worldwide. Our cold chains deliver vaccines that prevent global pandemics. Our research institutions develop therapies that serve patients globally. The question isn't whether Canada can become a major power in global health. We already are, through our unique combination of essential medical capabilities and humanitarian expertise. The question is whether we'll have the vision and commitment to leverage our health advantages strategically while maintaining the ethical standards and international cooperation that make global health progress possible. The patients are waiting, the researchers are working, and the future of global health is being developed in laboratories and facilities that serve humanity worldwide. Canada has the medical infrastructure to save lives globally, the research capabilities to develop breakthrough treatments, and the opportunity to lead international efforts to improve human health. What we do with this health opportunity will determine not just our role in global health care, but our contribution to reducing human suffering and improving quality of life for people everywhere. The health revolution is here, and it depends on Canadian medical isotopes, Canadian research, and Canadian healthcare expertise. Canada can either embrace our role as the invisible health superpower or watch others build their healthcare futures without our life-saving contributions. Thank you for joining me for this exploration of Canada's health empire. What aspects of our medical dominance do you think offer the most potential for global impact? Should we focus on medical isotope production, pharmaceutical development, or healthcare delivery innovation? Share your insights below, and I'll see you in the next analysis of the forces shaping our medical future.